Everybody's doing all right and enjoying football games and things like that. We were supposed to be, myself and Ray Roof, we were supposed to be at Percy Fall Fest today, but that naturally got rained out. So thought we would just do this presentation updated for 2023. Our Do It For Me Insurance Inc. Medicare Basics 2023 edition. Got like 40 slides or so. So we really added a bunch of stuff to it as opposed to years past. So working a little hard this week. As you all may or may not know, after October 1st, you are able to talk about 2023 plan options. And now we're into October. We thought we would do this presentation. So we're working hard. We're a little behind every year with our current clients. We usually send out our cards, with the letters we write and everything, and those are going out this week sometime. So we're working diligently to do that. Every year we try to do it earlier, but life gets in the way. So anyway, here we are, and we'll make do, and we're always here to help everybody. Feel free to call us with any questions, or if you're our client now or you're not, you can send us your prescription list and we can review to see if you're in the right plan, whether that be Medicare Advantage plans, Part D plans, supplements. We can always review. Things have changed a little bit this year. Some of these TV ads are starting to get a little ridiculous, and because of that, the government has Centers for Medicare and Medicaid Services has decided to require agents and brokers to record conversations. So now that's after October 1st, in order to discuss some benefits, we'll have to do that unless, we plan to get together in person, and that circumvents that. And actually even Zoom apparently counts as a face-to-face from places I'm reading. There's not a whole lot of guidance on it. And as you know, I work with about 200 brokers too that I help manage and give them product support. So you'll get the question all the time, and it's just not a whole lot of guidance. So we just stumbled into this. So, we appreciate everybody's patience. And anyway, let's get into the presentation. So here's Medicare Basics 2023 edition. Our agenda for today is Medicare Define, Parts and Coverage. We have Original Medicare, which is A and B, which you've worked for, paid your taxes for. Medicare Advantage plans, also called Part C. Prescription drug plans are Part D. Then we'll get more into Medigap or Medicare supplement policies, enrollment periods, when you can enroll, the different rules and things of that nature, how to start the process, and some questions. So let's get into it. Medicare is a federal program that provides health insurance to anyone who meets one of the following three conditions: people over the age of 65 or older, people under 65 with certain disabilities, people of any age with end-stage renal disease, which would be permanent kidney failure requiring dialysis or even a kidney transplant. What is a Medicare beneficiary? So I added this slide because if you've ever filled out paperwork or about to enrolling yourself in any type of a plan or policy, you'll often see the term Medicare beneficiary listed. And this can get kind of confusing because you think of beneficiary, you think of like a life insurance policy or an annuity where you're the beneficiary, somebody else's beneficiary. Here, it means you're the beneficiary of the Medicare system. So oftentimes people don't sign on that line because they're confused by it. So just when you're filling out paperwork, when you're ready to make a decision, and if you're doing it by yourself, obviously we're here to help you. We don't charge any fees. Our commission is standardized by the federal government. So we have no incentive then to not to do the right thing by you, not that we would any other way. But so when filling out that paperwork, the line that says Medicare beneficiary is where would be signing to put that into place. Medicare has four parts. Part A is your hospital related services. Part B is your medical care. You have Part C, which is Medicare Advantage, which often, in most cases, takes the place of A and B and also has prescription drug coverage in most plans, but not all. There are some that are Medicare only, and you would, you'd have a plan like that if maybe you didn't want prescription coverage, although we'll get into that later, or if you had like something like a VA benefit or TRICARE, or even like a prescription help, like extra help. LIS through the federal government, Social Security, or if you had something through the state level like PAD in New Jersey or PACE and PACENet here in Pennsylvania. Those programs vary. We're also going to get all into that. So original Medicare. Part A covers hospital care, skilled nursing facility care, nursing home care, hospice, home health services. Part B covers doctors and other provider services, ambulance services, durable medical equipment, mental health, limited outpatient prescription drugs. Continued. Medicare A is premium free for most taxpayers who work 40 quarters in the US. Or I know it gets into the weeds, but oftentimes through a spouse that has worked the 40 quarters too. If you paid Medicare taxes for less than 30 quarters, the standard Part A premium is $506. These are 2023 numbers. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium, and Part A premium for the one above is $278. Medicare Part B has a monthly premium for just about everybody. It can vary based on income, can go up or down depending on your income. Most people in 2023, this should say, pay $164.90. So it's actually going down $6, hence the reason why it's in green. So to save you a little bit of money, don't spend it all in one place, right? As a result of the income-related monthly adjustment amount, otherwise known as IRMA, legislation surcharges will apply for some, which we'll get into in a future slide. Okay, just making a note. All right. Original Medicare and other costs. Inpatient hospital deductibles going up to $1,600. Daily coinsurance for days 61 to 80 in the hospitals going to $400. Daily coinsurance for lifetime reserve days is $800. Skilled nursing facility coinsurance is $200. Part B deductibles going down from $233 down to $226, so a little bit more savings. And for those who have just immunosuppressive drug premium coverage only, that's going to be $97.10, which we'll get into more. Let's talk about the IRMA. So if your income succeeds for a single $97,000 or $194,000, then you pay additional to the $164.90. So you can see the charts here. It goes by levels. So it can be as little as $164.90, and it can go up to as much as $560.50. These are 2023 numbers. Actually, what has changed is not only have these all been adjusted, but these amounts have also have changed a bit, going up. So it was less before in the past. So it's definitely changed. This is if you're only getting immunosuppressive drug coverage only. So and we'll talk about what that is. So here's the premium for less than those amounts. $97.10 can go all the way up to $485. Not only do they surcharge your Part B with IRMA, they also surcharge your Part D, your prescription. So these prices, excuse me, allergies, are in addition to whatever you pay for your Part D premium. So if you buy a prescription drug plan standalone through a carrier of your choice, they have varying copay premiums. They can be as little as $7 a month. They can be as high as $178 a month or even more. This is just the amount that would be added to the premium that you're already paying. So if you're in this higher bracket here, you can expect to add $76 to whatever it is that you're paying for your monthly premium for your Part D plan. Or if you're in a Medicare Advantage plan, this will also be added since they do have a Part D element in most cases. Now, if you're married filing separate, so here you can see the basic is $164. And these numbers are definitely worth paying attention to. So 97 to 400,000 or so, you can expect to pay $527 for your Part B premium and $560 if you're even over that. For the immunosuppressive drug coverage only, you can see that even that will go up as well. And here's your Part D in general. So not a whole lot of wiggle room here. There's not a chart that's going in linear fashion like in the other sense. So it's just going right to the 70 and $76. All right, what is immunosuppressive drug coverage? Immunosuppressive immunosuppressants, otherwise known as anti-rejection drugs, are drugs or medications that lower the body's ability to reject a transplant or organ. So in that case of the end-stage renal disease where you had to have a kidney transplant, in the past, you could continue that up to 36 months after the transplant's complete, if that's applicable. Many it's not. And in 2023, as of January, they will extend that past the 36, but there'll be no other, if there is no other health coverage, but only the drugs will be covered and no other items or services in that instance. For more on this coverage and end-stage renal disease, please refer to the link below. You do not have to write these down. After we are done with this live cast, I'm going to put them in the description for easy access and labeled. And the final two parts of Medicare, Medicare Part C and standalone prescription plans. Medicare Part C, otherwise known as Medicare Advantage, government-sponsored option to receive benefits of Medicare A and B through a private health insurance company. So think of it this way. When you have original Medicare, you pay your Part B. What you do in this instance too, we'll talk about that. You pay your Part B, whether you're on an Advantage plan or if you have original Medicare. But think of it this way. When you have original Medicare, the federal government is, all intents and purposes, your insurance company, and sometimes you have some supplement in there as well. In this instance, imagine them saying, like, I don't do such a great job of being your health insurance company. I'm going to give an allotted amount, say around $1,200 or so. I'm not sure what the exact amount is, but it used to be around there, to the insurance company of your choice. And then they will pretty much do everything for you, administer that care. So though is essence why you see so many TV commercials this time of year, is because everybody just wants that money from the federal government. And that's why it's a bidding war, and there's just endless plans every year and endless carriers. Medicare Advantage plans help to pay for your out-of-pocket costs under Part A and Part B. Many plans provide Part D prescription coverage, often includes additional benefits not covered by original Medicare. So these are all your extra benefits that you're seeing your celebrity of choice advertising on the TV this time of year: vision, hearing, wellness services, dental, over-the-counter, gym membership, healthy foods, and it just seems to be never ending. You must be enrolled in Part A and B. These typically have a defined network. So unlike original Medicare, where you can just go to any doctor in the country that takes Medicare, and you don't need a referral or anything, with this, you're back to what you're used to: an HMO, PPO, a private fee-for-service, a cost plan, HMO, POS, etc. Medicare savings account. Part D prescription drug plan must be purchased in addition to Medicare Parts A and B. Offered by private Medicare approved insurance plans, the average cost for 2023 is $31.50, down slightly from 32 and change. Higher income enrollees pay a higher price for Part B and Part D as we went along, known as IRMA. So why do you need drug coverage? So if you don't have qualified drug coverage, either through an employer when you're on Medicare, or a union plan, retirement of some sorts that meets Medicare's guidelines of credible coverage. If you're not on Medicaid through a state or a pharmaceutical help plan like PACE, PAD, extra help from Social Security, then there is a fine or surcharge that's charged for every month that you do not, after the first 2 months or so, every month that you do not have prescription coverage, and they do not enforce that until you go to buy something in the future. So if you go to buy a Medicare Part D plan, or even an Advantage plan, doesn't matter where you go, the federal government keeps track and says, okay, Mr. Smith went 10 years without drug coverage. You need to apply, say, $30 or $60 a month to whatever plan he buys. And there is a formula for that. That formula is you take $31.50 times the number of months that you went without credible drug coverage times 1%. That is the monthly amount you can expect to add on to your plan, either your Part D plan or your Advantage plan. So this part is standardized as the coverage levels, and there still is a donut hole coverage gap. It's going down and down and down. It's going to be changing under the spending bill for 2025, but we're not going to get into that now. So phase one is going to be your deductible phase. It's gone up a little for 2023. The max it can be is 505. Some are zero. The zero deductibles tend to be more expensive. Whether or not that's worth it or not, we have great software we use to connect your through a program we have called Medicare Edge. And if anybody's interested in looking at some of those options, I can put detailed proposals together to send you. Feel free to message me or email or text me. My contact info will be at the end, or just go to doitformeinsurance.com or doitformemedicare.com, which is our landing page for Do It For Me for Medicare. Make it nice and simple. So after phase one is your phase two, your Part D insurance pays. So this is a combined number. This 4,600 is going up again too. So basically, the cost of the drugs, not just what you spend. So after you met your deductible, you have co-pays, and usually the deductible for tiers 1 and 2 generics is not applicable to that deductible on most plans. Some of the cheaper plans is just tier 1. So there's five, sometimes 6 tiers of drugs, anywhere from basic generics for the first 2 tiers to preferred brands to non-preferred brands to specialties and so forth. So in that phase one, you're paying that deductible and then paying whatever co-pays. When the combined total of what you and the plan pays reaches $4,600, that's when you reach your donut hole, in a sense, where you're paying 25%. So if you have been on Medicare, or you have a friend that has a lot of prescription utilization, and they say, hey, in the middle of the year, this plan really, these drugs just really got expensive. That's what's going on there. They're hitting that donut hole. And then you're in that phase from 4,600 up until the total 7,400, which you then enter your catastrophic phase where you pay very little. So these are the updated numbers. The greater 5% or $4.15 for generics and $10.35 for all other drugs, brands and such. Help with drug costs. So, I would say when you retire, or, when you're aging into Medicare, as we call it, I would say the coverage options tend to be better in most instances than what you've had in the past in most instances. But, the drug plans can really be, it can be eye-opening, especially if you're used to just paying a couple dollars here and not having to deal with that donut hole. This can really be eye-opening. But there are help for drug costs. So there are plans through Social Security, Medicare, called Extra Help, or LIS, Low Income Subsidy, and they can help pay your Part D premiums, your deductible, your co-insurance, and your co-payments. It also can pay any Part D late enrollment penalties that you might have. Now, to qualify for that, generally, individuals with an income limit of no more than $20,385 and a resource limit of $15,510. And for a married couple, those numbers are $27,465 and a resource limit of $30,950 can qualify for LIS or Extra Help. Pricing varies based on the income level, right? So the lower the income, the better the help. The higher the income, not so much, but still worth looking at. It surely doesn't hurt to ask, when enrolling, to see if you just apply for Extra Help. They'll give you an application, help you do that. We can't do that for you. We can't help you with your A or B, or a lot of your state programs like Medicaid or Social Security, like Extra Help, PACE, things like that. They just don't really want brokers doing that stuff. But we can help point you in the right direction, tell you where to go to get that information, or if you want to make an appointment with somebody, we can help get you in touch with the local Department of Aging and so forth. So here's a resource here again, Medicare.gov basics, cost, help, drug costs. So again, I'll have that link at the end in the description. So help with drug costs continued. In addition to LIS and extra help, many states offer state-run programs to assist with high drug costs as well. As we mentioned, that would be PACE and PACEnet in Pennsylvania, and that would be PAD in New Jersey. PAD in New Jersey, in some instances, actually pays the Part B premium for some people, and the income levels tend to be a bit higher than what you see with extra help. So here's a resource here as well. If you want to see what is available to you in your area, you can just put your zip in there, or you could just ask me. Um, we have about 17 licenses here. We know PA, Jersey, and Delaware very well. Maryland too, but Florida, we work all over. We can at least get the information for you. And when becoming eligible for Medicare, often manufactured coupons and programs become void. So you have to read those coupons and those programs, $5 card you get, or it still doesn't hurt to call the manufacturer. Just because you have to have some type of drug coverage doesn't mean you need to use it. So services like GoodRx or ScriptGo or what have you can be very beneficial too, worth checking out, always worth to compare. When going to a pharmacy, you present your card and then you get your coupon with GoodRx, see which one's better, and then you have them process it like there. But there's a tool here too that can help you determine pharmaceutical assistance program that might be available based on the drugs you take. It's worth a look as well. Just don't assume that you make too much money. If you don't ask, you don't know. So it surely doesn't hurt to ask. Let's go on to Medigap plans or policies, also known as Medicare supplement policies sold by private companies, fill the gaps in original Medicare. So in this instance, you're keeping A and B, which you've earned and paid into, and you're paying the remaining 20% that those typically don't pay. And there's a whole chart to talk about the holes in that. So we don't want to get into all that, but that's in the literature, Medicare supplement policies. You must have A and B to buy a supplement policy. Medigap policies are standardized. You cannot have a Medigap policy and a Medicare Advantage policy. With these, they do not cover prescriptions, so you would need to pick up a Part D plan unless you're, again, getting something from a retirement plan or a state program or veterans benefits, something of that nature. Medigap plans continued. Generally speaking, Medigap policies don't cover long-term care like a nursing home, vision, dental, hearing aids, private duty nursing, or prescription drugs. Some Medigap policies cover travel outside of the U.S. Usually the benefit's about $50,000 or so as a lifetime benefit. But, people ask a lot of questions with this. We offer travel plans through companies like IMG Global. They're very inexpensive. It's worth checking out. You can usually get them up to the day before you leave. There is a tool on our website, doitfrominsurance.com, that you can get to the quote tool yourself, or, I'm very happy to do that for you as well. That's what we're here for, make us earn our living. Great option for people who are currently receiving or seeking ongoing medical treatment. So you're turning 65, you have a lot of utilization. These plans are pretty straightforward. They're all standardized. Some give you little extra bells and whistles, like a gym membership with a couple carriers in the area, depending on where you're at. But if you're going to have high utilization, sometimes these policies pay for themselves, and there's some nuances of when you can buy and change that are worth noting too, which we'll get into. So you have your Medicare supplement open enrollment period. This is the best time to buy a policy because it's guaranteed to you. The prices we show you here are the prices that they have to take you at. This is within the first 6 months of your birth month of being 65 and 5 months after, or if you're leaving employer coverage, or if there's other circumstances like your Medicare Advantage plan leaves the area, you make it a letter that says you have guaranteed issue rights. That just simply means they're not going to ask you health questions. And these plans, again, are standardized, with the most common being G and N. F is not available for people unless they were on Medicare prior to January 1 of 2020. G and N in most places are the most price competitive. G covers just about everything other than the Part B deductible, which we went over earlier, was $226 or so. So basically, simply put, on Plan G, you pay the first doctor each year $226, and that's a calendar year, after which you pretty much don't have any expenses related to your medical care. This, again, doesn't include prescriptions. Plan N is similar to that. After that $226 is made, you then go to a copay of around $20 and $50 for the emergency room. Other thing to note with that is excess charges. So in Pennsylvania, we're one of a handful of states who still makes it illegal for a doctor to charge an excess charge, meaning they're not happy with what Medicare pays them and they want to charge an excess. PA, we make that illegal. Most states, including Jersey, Florida, Delaware, do not. So there, you could go to a doctor and hopefully they make that expressly clear to you. This is kind of made into more of a big deal than it is, but it's to note. I think the most it can be is about 15% extra if it happens. And in the day of Yelp, doctor that's gouging seniors isn't too popular, so word tends to get around. You just really don't see it all that often. You can do your research on that, but it's not all that prevalent, but it's still worth noting because it does exist on end. So G would cover those excess charges and would not. Also, things that get confusing is if you were, say, on Medicare Part A prior to 2020, you continue to work, you then pick up your B when you retire, you're guaranteed. So I'm sorry, if you had your A and your B and then you retire, your guaranteed issue is F. You have to take F unless you want to underwrite. If you were on eligible for Medicare after that January 1, 2020, then your guaranteed issue plan is G unless you wanted to underwrite. If you did not have your B and then you pick it up upon retiring, and we'll talk about the rules at the end there, then you have your pick of any plan you want without health questions being asked in most instances. So your enrollment period, so your initial enrollment period, which is that 7-month window, that straddles your 65th birthday. So this would be the 3 months prior, your birth month, and 3 months after. That is for things such as Part D and Medicare Advantage. Also signing up for Part B within that window, unless you're currently continuing to work. Medicare supplement open enrollment period is a 6-month period starting the first day of the month of your 65th birthday. So your birth month and 5 months after. You can do whatever you want. If you want to apply to a different carrier every week of that 6-month period, you absolutely can. For your supplement, for your Part D, once you've used the election for the year, that's kind of it for that. We can talk about that more. But yeah, for supplement, if you want to change every week, you totally can. After that 6-month time period's up, then everything's going to be based on your health at that time. They're going to ask questions. You never know what an underwriter is going to find. The general enrollment period and open enrollment period are from January 1st to the 31st of each year. And the annual enrollment period, which we are now entering, where you're going to see TV ads. So that starts on the 15th, but we're allowed to discuss and market on October 1st, which is why our letters and emails and stuff are going to be going out and stuff like that. So that explains the different enrollment periods, and there's some more too that we'll get into. So your initial enrollment period, you can enroll in Parts A and B, enroll in a prescription drug plan, enroll in an Advantage plan if you choose. If you don't sign up for A and B or Part D when you're first eligible, you could face penalties in the form of higher premiums. So there's late enrollment penalties for B and late enrollment penalties for D if you don't have applicable drug coverage. So it's not all these rules are explained to you. You think with all the mail you get in the mail box every day, every year, every month, every week, whatever, you would think it would be pretty hard to mess this up, but people are people, things happen, life gets in the way. So, it's good to know the rules, and we're here to help you with that. And even if you're not a client, we still help you anyway. We don't charge any fees. We never do. Always fee service, unless otherwise specified, which at this point we don't have any product that is. Your general enrollment period. So if you can sign up for A or Part B between January 1st and 31st of each year if you missed it. So if you didn't sign up when you were supposed to get it, you can do it at this point. If you don't have another special enrollment period, like a loss of coverage or something of that nature. And in those instances, the coverage starts July 1st. So when you enroll during that point, it starts July 1st, but only in that specific instance here does it do that. Your annual enrollment period. You can make changes in enrollment Medicare plans through October 15th to December 7th. If you have original Medicare, you can switch to a Medicare Advantage plan during this time. If you have a Medicare Advantage plan, you can simply buy a Part D, which tells the federal government you wish to disenroll from Advantage. But you're not guaranteed a supplement. So just remember that. You can get back to Medicare, original Medicare, your A and your B, but there really is no guarantee that you can get a supplement. You can switch your Medicare Advantage plans during this time. You can join or drop a prescription drug plan, as we discussed. You can also update your coverage by switching to a new plan with your current insurer to a new. So we just kind of went over that. And then your coverage would begin January 1st there. So your open enrollment period. So this is a period of time that kind of goes along with that general election period. It's not something that can be advertised. So companies, why you don't see TV ads. I mean, you see them during that time of year because if you called, it can be discussed with you. You can research this. There's been news articles and such out and things on the TV talking about it. But during this period of time, you can obviously pick up A and B if you haven't. You can also, if you're in a Medicare Advantage plan, you can actually make a switch during this time, one switch during that time. So in theory, you could switch a plan during the annual election period. And if you're not happy, you can change it during this open enrollment period as well. And like I said, you can buy a Part D and go back to original Medicare if you wanted, but just remember, Medicare supplements are not guaranteed. And again, they can't freely advertise this because otherwise they don't want people really abusing this. People meaning plans and TV ads and call centers and such, your celebrities on TV. Good to know is your Medicare Advantage trial right, and this can get a little interesting here. So with Medicare supplements, you have a free look period of 30 days for Medicare beneficiaries decide if they want to keep that plan or not. Your money back, no problem if you're not happy with it. Whereas Medicare Advantage plans offer a trial right in some specific circumstances. So if the Medicare beneficiary drops original Medicare and a Medigap policy that they currently had to enroll in Advantage for the first time, and they have a 12-month period to change their mind and return to the previous policy if available. So take on an Advantage plan. You're not happy with any time during that first year, simply drop, go back to the coverage, the exact coverage you had. If the coverage you had is no longer available, then you have a guaranteed issue period to then buy coverage through another company. Continued, the Medigap policy is no longer permitted to offer prescription drug coverage. This is good to know. Medicare plans, supplement policies years ago used to have, prior to Part D being a thing, used to have built-in drug coverage. So even if your plan that you left had that you were grandfathered to, and even those grandfather plans, sometimes that doesn't meet and you still needed a Part D coverage, but so they can't do that anymore. So if you had a plan that had prescription benefits, you left it for an Advantage, you could go back to that plan, but you're in most instances not going to have that prescription drug coverage in that plan. If the Medicare beneficiary joins a Medicare Advantage plan when first eligible for Medicare, they can choose from a Medigap policy. So, you learn everything. So within your first year, so you join an Advantage plan within that first year of being in that Advantage plan, when you're just turning 65, it does appear that you can actually pick up a Medigap policy of your choice if you're not happy within that first 12-month period. There's also some states provide additional special circumstances. For more on this, I recommend you go to the link below, and again, I'll put that in the description. Medicaid and Medicare plan options. So Medicaid provides health coverage to millions of Americans, including eligible low-income individuals. Medicaid is administered on the state level and funded jointly by states and the federal government. So it's meant for low-income individuals, children, and such. Insurance companies offer those with Medicare and Medicaid special Medicare Advantage plans called dual special needs plans, or what we call as DSNPs, with various network options and extra benefits. So again, Advantage plans are all about the extra benefits, right? The D-SNPs have even more extra benefits. So in some cases with certain carriers, the network is the network with the D-SNP as it is with the regular Medicare Advantage plans. Advantage plans are all about the network, remember. Some are very limited. Some are starting to offer PPO plans, which is interesting. So, it's always worth kind of poking around, at least on our website too. Most of the plan options you can put in there. And also I have to add a disclaimer, which I did in the beginning, and is that we're now told that we have to say that we don't offer every plan in your area. We're limited to showing you the plans that we are authorized to sell. For a complete listing, go to medicare.gov/find a plan. I'm going to say that in the state of Pennsylvania and Jersey and Delaware, I pretty much have every plan and company that you can imagine. I like to just have everything available so there's no surprises, so I can give you an unbiased opinion. But there are certain instances where an agent can't represent certain plans, such as an institutional plan, like an Ericsson or a Sunrise. Those don't usually let agents sell, to my knowledge. Or there might be a plan here or there where a carrier is not paying a commission for, and therefore we're not able to say that we're certified for that. But I'm always going to do what's right by you. My tool will show all plans in the area, plans I have and I don't. I can, which is some basic information, just a zip code. You can even give me a fake name if you like. I can give you 3 plans I think that work best in your area. And through that link, you should be able to see everything too, and always do that due diligence for you. So insurance companies offer special needs with various network options. These plans have specific governance as to who can apply, when they can apply, and how often they can apply. So aside from your usual enrollment periods, the annual enrollment period and special elections, D-SNPs can actually be changed once a quarter in the calendar year up until about September 30th. So the fourth quarter, they cannot change. In that case, they'd be using AEP to enroll for the first of next year. Well, this has changed within recent years. It used to be that you could just freely change as much as you want, but that was getting to be a bit of chaos. So they came in and said, you can only really make one change per calendar year, because it's just kind of is a headache for plans if you're switching here and there, and it's not easy for you either. Chronic condition special needs plans, known as C-SNPs, restrict enrollment to individuals with specific severe or disabling chronic condition. Chronic conditions require coordination of primary care, mental health, and specialist providers, including in and outpatient facilities. Often extensive ancillary services, diagnostic testings, and therapeutics are required. One or more comorbid and medically complex chronic conditions, which are sustainably disabling or even life-threatening, would be a requirement in which to get a C-SNP. C-SNPs are availability can be limited, or there might not even be any at all, depending on an individual's geographical location. So where you live dictates if there's actually a plan available to you, and it can help you do that. Medicare.gov has a lot of resources on that as well, but I can absolutely help you with C-SNPs if they're available to you. And if it's something I don't offer, I'll at least give you the guidance as where you can go to get it free of cost. Institutional special needs plans, known as I-SNPs, are designed for Medicare beneficiaries who for 90 days or longer have or expected to need the services of a long-term care facility or skilled nursing facility or other eligible institution. There's also certain I-SNPs that operate a single or multiple facilities, like those Ericsson or Sunrise. They're kind of doing their own plans in essence. And they can be established county-based service areas as long as there is at least one long-term care facility in that network, and that they can accept enrollments, and that is accessible to the county residents. This all comes from Medicare.gov, just kind of paraphrasing. Special enrollment periods. What if you're outside of AEP, OEP, and do not qualify for D-SNP, C-SNP, or I-SNP? There are many different enrollment periods that exist, which allow people to to qualify for plans, make changes, and every year there seems to be more. So in the Pennsylvania markets, we have a couple 5-star plans. So we've been doing this since 2011 or so, and I have really never known of a 5-star other than maybe like an Erickson institution type ISNP plan. This year we had Independence Blue Cross, Aetna, Highmark, and UPMC all had 5-star. So with a 5-star plan, once per year for whatever reason. So right now we're in October. If you want to buy one of those carriers plans for November 1st, and you haven't so used that 5-star election period, you can do that. You can get yourself into a 5-star plan for November 1st. Don't have to wait till January. That's just one instance. Also, if, like I said, if you're working still, you lose that coverage, LEC, loss of employer coverage. If you gain or lose LIS or extra help eligibility, there's an SEP there you can change. If you move out of your planned service area, a lot of times there's natural disasters such as the hurricane. I hope everybody, if anybody's watching that from Florida, I hope everybody and their family's well or has family or friends down there. So, but that's in instances where they'll probably make a special enrollment period out of that. It affected your ability to enroll or change a plan, etc. And then there's, again, it's hard to, we'll be here all day if we put everything up. So, here's a link that's useful that you can look at as well too. Medicare savings accounts. So compared to an HSA or health savings account, Medicare savings accounts designed to work for Medicare beneficiaries. So normally with an HSA account, that's through an employer, you bought it through yourself, you had a bank account associated with it, you paid for expenses out of that bank account. There was, some tax savings to be had at the end of the year. Typically when you go, when you retire and you leave the plan, or you're over 65 on Medicare, you typically can't contribute to that HSA anymore. You can keep those funds in there in most instances, and they can grow, or you can take them out, do what you want with them. Not a financial expert in that, but that's just, what I experienced. Medicare savings accounts are designed specifically for Medicare beneficiaries. So they have a high deductible. In most cases, you're going to pay everything up to that deductible. But unlike most HSAs, although maybe your employer helped contribute, or you had an HRA or a flexible spending account, something of that nature, there's all kinds of different rules. MSA plans actually deposit money into the qualified bank account to use for medical expenses. So if they say you buy a plan that has an $8,000 deductible, the plan might then fund that with $3,000 to $5,000 depending on, and then so someone who is known to really hit that out-of-pocket max. So like, the highest the out-of-pocket max can be about $8,000 or $9,000, and that can vary. So that's on a Medicare Advantage plan, right? So instances where you're going to multiple stays in the hospital, or if you have a Part B injectable like a chemotherapy or something of that nature, you can easily hit that $8,000 or $9,000 out-of-pocket max. MSAs, if you're traditionally doing that, this may be less out of pocket. That sometimes tends to draw consumers' interest in that period too, in our experience. So they do not cover Part D, but here you can actually buy a Part D. So with a Medicare Advantage plan, you can't buy an additional Part D. You can't buy Medicare only and then a Part D either, unless you have something else going on like extra help or PACE or TRICARE or something of that nature. But here you can, because they do not cover Part D, so you can buy a standalone Part D. And if you don't, and you don't have something else, and then remember there's enrollment penalties. So the plan benefits, deductible, enrollment periods, and other nuances are different than typical Medicare Advantage plans. So you don't get the freedom to kind of choose and change. Here, where the money's deposited to you, if you leave midway through the year, you're actually on the hook to owe that back a prorated amount. So there's a lot of nuances to the MSA plans. So far, at least in my market here that I've seen, they haven't really been all that popular. There's really only one company that's doing it. But, I like to mention it because it exists. And, for the right client, it can make sense. So maybe somebody goes to a lot of alternative medicine, like acupuncturist and vitamins and things like that. It's not really using traditional healthcare. This might make sense because you get that money and you have a lot more expenses that You can look up health saving Medicare savings accounts expenses on the IRS website. Usually tells you what qualifies to be used as that. So, and also your plan is going to give you, probably a thick book on it as well, like they do anything else. Private fee for service and cost plans. These aren't all that prevalent everywhere. So private fee for service, I know of a couple in the area, are a type of, say the area, say 5-county Philly region. They are a type of Medicare Advantage plan. Unlike traditional Medicare Advantage and Medigap policies, the plan determines how much it will pay providers and how much the member will pay when receiving care. They may or may not cover Part D coverage. Standalone Part D plans can be purchased if it's not provided in the plan. Members should make sure here that the providers agree to treat under the plan and accept the plan's payment and terms before services are rendered, or otherwise, if going out of network, you may not have coverage at all in a non-emergency. In emergency, they can't really get away with that. So there's some nuances to private fee for service plans. Medicare cost plans are really limited. I don't know of any in PA, Delaware, New Jersey. Forgive me, I'm not the best expert on that, but I have not seen them. According to the Medicare website, Medicare.gov, there are very limited areas of the U.S. Enrollment is allowed whenever the plan is accepting new members. Members can leave anytime and return to original Medicare, and are permitted to purchase a separate Part D plan. Whether or not that plan has drug coverage in it, you can still buy the Part D. That's kind of unique. Individuals with Part B only, so if you have Part B and not A, they can join, and those with Part A and B are covered under original Medicare when seen by a non-network provider. So that's pretty cool too. Members will pay the Part A and Part B co-insurance and deductible. That's not so great. Those are usually covered on other type of plans for the most part. Happy with your current coverage? Get this a lot. People are working well past 65. So if you're not paying much or anything at all, and you like that plan, here's how you can go about it. If you you or your spouse work for an employer that has more than 20 employees, you can, unless specifically said, and you want to kind of coordinate with the HR department, right? Because, especially with unions and retirement plans, things can be different. They may want you to take that B, but most cases you could probably get away with paying your Part B premium until you go to enroll. You get a letter from your employer, the HR department, when you're ready to term. Make sure you have a date on that. Also, you want to communicate with Medicare what you're doing. So, if you say, hey, I'm still working, I don't want to take my Part B, I wish to delay it, it's good to get on record and say that. I recommend you call, so that they record the call, because that's what they do there at Medicare, Social Security, Medicare, or 1-800-Medicare. They record those calls. So, express to them that you're still working and you wish to, delay that B. So you can usually do that if you're over 20 employees. If you're under 20 employees, or your spouse works for someone under 20 employees and you're covered under that, that's always kind of been messy, but it may be necessary, or at least strongly encouraged, to take Part B, because in the first case where it's over 20 employees, the employer coverage is the primary and Medicare is just picking up the difference. When it's under 20 employees, it's the opposite. Medicare is the primary, hence they typically tend to want you to have that B, and the employer is secondary. So if you do not have Part B, or instance A, if you didn't qualify, didn't work enough quarters, new to the country, whatever, what have you, there could be an access to your care, and things might not get billed properly or even covered. So it really is recommended that you take Part B if you work for a company or an employer under 20. Here's one we deal with a lot. If you're covered by the Health Insurance Marketplace or Penny, Get Covered NJ, Covered California, a state, what we call a state-based exchange, Maryland Health Connection, or even COBRA, because there's some nuances if COBRA is considered credible coverage or not. The rules can get complicated here, so I really don't want to get all into this. I refer you to this link here below. It really is easy to use, and no one's going to call you. This is the Medicare.gov, not .com.gov. It's run by the federal government. It has a lot of good resources on there. Also, these companies and solicitors are starting earlier and earlier. Things really look like they're from Medicare. 9 out of 10 times somebody shows me, it is a solicitation. So be wary that if something sounds too good to be true, it typically is. Take a picture, text it to me, email it to me, give me a call. I'm happy to make sure you don't make a decision and be stuck in something that you shouldn't be, or is not the right fit for you and might not be able to get out of in certain instances. All right, so how do you start the process? If you are going to collect Social Security at 65, in most cases, it's still good to check. Usually the A and the B are going to be turnkey and the B is just going to start coming out. If you're not going to collect Social Security, then you do have to usually take some action. You're going to actually usually pay a quarterly amount. And I do get a lot of panic calls of people saying, hey, this bill's $700, it's $500, just relax. It's your Part B premium, the 164 this year in 2022, it was 170 times however many months. So usually it's a quarter, like 3 months, but in certain instances, if on the billing cycle, maybe includes 5 or 6 months, or you do it a little late and it's taking you back to the first of your birth month, instances like that. So in most cases, if you take that amount divided by the standard Part B amount, that usually is just telling how many months you're paying that initial bill. So there's usually some chaos surrounded in that for some people. So review and enroll in a supplement policy or Medicare Advantage plan. If you enroll in a prescription plan, if it's if it's needed, like if you're not getting it somewhere else, if you bought a supplement, you most likely in most instances need that prescription plan. If you buy an Advantage plan, you shouldn't. You actually shouldn't be buying a Medicare Advantage plan without prescription unless you have something else going on, like you have Met benefits or PACE or PAD, or sometimes you just get the retirement benefit for the drugs. I've seen that, and not so much for the supplement. You're never bothering us if you ask us to take a look at your retirement plan. I've helped out with the teachers in the teachers union before. I mean, hey, things change. In the past, it used to be that if you had retirement benefits, like, hey, you were pretty much set for life. But as time goes on, these unions, these organizations are starting to kind of lose money. They start to take away benefits. An important thing to ask is, when do you need to enroll? If you leave, can you come back? Sometimes that's a big one. I know, like some of the retirement plans used to have really good prescription drug coverage, which sometimes didn't even have donut holes in it, but tended to be kind of costly on the quarterly amount, or there's dental and vision baked in there. So it's good to communicate with that HR director and not just make haste decisions. Understand what it is you have, what happens if you leave, can you get back? A lot of times there's specific rules, and it's good to understand that before you do something you're going to regret. And that is it. So it's hard to see because I'm broadcasting a Zoom, but let's see if there's any questions. Did this last minute, and usually with Facebook, you have to pay to boost your post, or the people that actually like your page don't usually see it. So we don't look like we have a whole lot going on there. So, again, get in contact with us here. So I work for Custom Benefit Plans in the bottom right corner there. I am the product specialist, broker manager, business development. I coordinate with brokers, help tell them what plans are right for them to sell where. I'm pretty good in many, many different states. So if you're a broker or interested in being a broker, I'd love to have that conversation with you. We're not a captive shop. Everybody's an independent. So you succeed and fail on your own terms. There's it's not like a health markets or something like that where you're getting a salary and then getting half of your commission. You tend to get all of your commission in this instances. Or, we can work with you too, like if you're looking for that kind of career opportunity. So that's what I do in Custom Benefit Plans. Do It For Me Insurance is my corporation I set up. I'm the principal and sole owner of that. doitformeinsurance.com. Do It For Me Medicare.com is just simply doitformeinsurance.com, but is a landing page with Medicare resources. If you go to the main page, there's a pop-up that comes up and says you're here for Medicare. So you can't go wrong if you go to each. So we have quote tools and such on there. So let's see, we'll show you the site a bit. So this is Do It For Me Medicare. You can run quotes or supplements. Well, that's not the greatest tool. Part D and Advantage plans, very basic. Put in your zip. And since it's after the first, it should also show you, okay, so it's not working. And we also have, so Medicare Edge is our version of Connecture, which we have, which allows us to, so there's not a link that you can go to at this point. So this is something I have to kind of put together for you. But again, I don't need a whole lot of information to put things together for you. So here, so it is showing 2023 plans. So this is one of the vendors I use. So not all the plans I have are on here, but the majority are. So we actually moved our Aetna to another vendor. So that's currently not showing, but of course I still have Aetna members with it and people who are interested. So you can kind of filter here. You can compare. You can, on the 15th, you can actually buy a plan right here, but it doesn't cost you anything to talk to me. So I'm happy to talk with you. But here, I mean, if you just get in touch with me, it can do, I mean, just to show you just the basics of what I need, really just need a zip. I mean, you can just even make up your name if you wish. So this is something I have to facilitate. I first have to usually send you a form before I can show you the plans in this instance. In this instance, you don't have to. If you're going to enroll, it'll ask you. But just the form is called a scope of appointment. Just basically says that we talked about the things you wanted to talk about. I didn't knock on your door and say I worked at Social Security or Medicare, which is activity that used to happen, and hence, the more regulation that comes is usually a result of people taking advantage of a system. So here's my system. And like I said, add non-licensed plans. Like I always do this. So, I want to do what's right by you. If an agent doesn't want to do right by you, there's really not a whole lot to be had here. One, it is not worth jeopardizing a career over a commission. I mean, it's all standardized. Like it's so if someone's really pushy, they're in a call center type situation where they just really need it. I mean, fortunate here, we have a lot of clients. We've been doing this quite a long time, and we're always going to do right by people. That's just our motto, and there's no reason not to. And it's just not feeding you a line. We're not typical pushy salespeople. We are educators. We are advisors. So again, here, so what's nice about this is if you send me more information, such as, a list of prescriptions and stuff, I can really do a lot more with this. So like, for instance, type of stuff I can do. So, by the way, Connecture, powering Medicare Edge, built the original Medicare.gov/find a plan up until a few years ago. And it's really not been as great as it once was when they had it. That's my opinion. Don't take that take that for what it's worth. But so this is a very reputable company that we have. And if you're an agent with us and you have your contracts with us, for every contract you have, we give you access to this. And if you have contracts elsewhere, we can work with you too. We got tired of uplines only giving us access to the plans we had with them. We wanted a solution that just fits everything, and that is what we did. And we offer this free of charge to our agents who do business with us. So I had a couple. common ones. Some of the things we can do for you. All right, we put your pharmacies in here. So again, this functionality doesn't exist with an easy link from our website. We're hoping to in the future, but it's not going to be for 2023. Just is what it is, but it's very easy. I mean, again, I can just, with basic information, you don't even have to give me your prescriptions, but we can collect those from your doctors, to make sure you're in the right fit. So we're just going to just keep with CVS now, but this is the type of thing that we can do for you. So total estimated cost, this is how we can sort by, so look, again, we're showing all plans in your area. These are Part D. Here's Advantage plans. Total estimated cost. I like to look at plan premium costs. Or no, I'm sorry. I like to look at estimated drug cost. See what's, so what this is doing is sorting by the plans that are right for you. So I can pick up to 3 plans. Looks like I already did. I can hit compare. And I can send you this quote, and then you can see how things change, plan details. I'm just randomly picking plans here. I don't particularly advocate for those. So here it's how much your drugs would cost on that plan, your total cost, when and if you might hit a donut hole. I'm actually looking at 2022. So we have this updated for 23. So I can run this for 23, and I can just send this to you. You can do all this functionality on your own, and you can actually look at more through that link. You're going to be stuck with the plans that I represent, which in PA, Jersey, and Delaware really aren't much. But again, it's a new disclaimer we have to offer, because a lot of these call centers, they're not from this area. They don't work with things like Blue Crosses. And they're just kind of pushing what they have and not really doing the due diligence, not checking the drugs, and they're not checking your doctors. If you don't do business with us, that's fine. I want you to be in the right plan. Make sure whoever you're working with checks your drugs and checks your doctors. These things matter. You don't want to find out before it's too late. And in some instances, maybe you lost something that you can't get back. But I mean, there's really not much that we just don't have. So that's that. Thanks for your time. Enjoy your Sunday dinner or whatever you're doing. And around for consultation, for Zoom, for in-person stuff, you can come to my office in Willow Grove if you like. We book appointments. And yeah, so thanks so much, and take care, and talk to you soon enough.